Hello everyone, Assalamu alaikum. We started to talk about the important points to include in the report of cardiomyopathies, and as we mentioned earlier, that as you all may know how to diagnose cardiomyopathies, so I'm not going to go deep in the pathology or how to diagnose, although that the main approach is while approaching a case of MRI, whether this is a dilated cardiomyopathy or whether it's hypertrophic cardiomyopathy. Dilated cardiomyopathies, and then we could narrow down the differential diagnosis. And if it's hypertrophic cardiomyopathy, then we need to look whether the hypertrophy is symmetrical or asymmetrical in order to narrow down the differential diagnosis in this direction. For example, starting with the HCM. In HCM, the points that we need to include in our report, or the main points, in addition, of course, to the function and volume, but we need to comment on the type of the HCM, whether it's the asymmetrical septal hypertrophy or is it the apical form of HCM. Septal wall thickness, of course, is an important point that is related to the prognosis of those cases. So we need to comment on the septal wall thickness and to mention it in the report. Of course, whether it's an obstructive subtype or non-obstructive subtype, whether the SAM is caused by abnormal or an accessory papillary muscle or caused by the cord. So it could be a chordal SAM or it could be an accessory and abnormal muscle. Those points are really important in the management of those cases. And of course, if we see a SAM and an outflow tract obstruction, sometimes in MRI it is underestimated the velocity of the flow in the LVOT. So we would need, you might ask the patient to do a Valsalva maneuver and then repeat the flow sequence in the LVOT in order to obtain the accurate and correct gradient. And if there is a SAM and probably there is a secondary mitral regurgitation, then we need to quantify the secondary mitral regurgitation. Also, we will need to comment whether there is any kind of mid-cavity obstruction or any kind of apical aneurysm, because those points are would stratify the risk assessment of those patients. For example, this is an apical form of HCM. The other form or the other point that we need to mention is whether there is fibrosis or not. And if there is fibrosis, then we would need to quantify the amount of the fibrosis. Now, there are many softwares that could quantify the amount of the fibrosis, because if the percent is more or above 15%, this indicates that this patient might need an ICD in order to avoid any sudden cardiac death. For example, here it's patchy in the septum, so we would really need to quantify the amount of this fibrosis. Again, fibrosis usually in HCM is patchy and mostly in the hypertrophied areas. And thank you.